Most people believe eating healthy is about choosing the right foods, but many do not realize that how foods are combined can quietly overload the kidneys. Even meals that seem clean, like a green smoothie or fruit bowl, might be creating serious internal stress. According to the National Kidney Foundation, over 37 million adults in the United States already have some stage of kidney disease, most without knowing it. That makes understanding food combinations absolutely critical. Some popular pairings, like spinach with almonds or bananas in smoothies, seem nutritious, but are packed with harmful elements like oxalates and potassium. These nutrients are healthy in moderation, but when combined and consumed frequently, they force the kidneys to work harder than they should. As someone who has worked closely with renal patients, I've seen how these well-meaning habits can speed up kidney damage, especially when phosphorus, potassium, oxalates, and proteins are stacked together. Your kidneys are responsible for filtering waste, balancing electrolytes, and removing excess fluid from your blood. But when you load them up with food combinations that are rich in oxalates, overloaded with potassium, packed with phosphorus, or dense in animal protein, they struggle to keep up. The filtration system becomes overwhelmed, similar to forcing oil, dirt, and sand through a narrow funnel. Over time, this overload can cause kidney damage, raise blood pressure, and even contribute to the development of kidney stones or kidney failure. That is why, in this video, we are going to look at some of the most damaging food combinations that most people do not even know are hurting their kidneys. I will break down why each combo is harmful, what the science says, and what you can do instead. And there is also a bonus tip at the end that could help your kidneys recover and function better, even if you have already made some of these common mistakes. So now let us start with one of the most common and misunderstood combinations in the health food world. It is one that many people eat on a daily basis and believe is doing them good. But if you have any kidney concerns or just want to protect yourself long-term, this pairing could be doing the opposite. Let us talk about spinach and almonds and the kidney risks that come with putting them together. Spinach and almonds are often seen as nutritional powerhouses, which is why so many people combine them in meals they believe are clean and wholesome. Whether it is a green smoothie made with raw spinach and almond milk, or a spinach salad topped with sliced almonds, this pairing shows up frequently in the diets of people trying to eat healthy. But if you have kidney concerns, or simply want to avoid future problems, this combination may be doing serious harm behind the scenes. Both spinach and almonds are extremely high in oxalates, which are natural compounds that bind with calcium during digestion. When that happens, especially in large amounts, these oxalates form tiny crystals that can deposit in the kidneys. Over time, those crystals can become kidney stones, most commonly calcium oxalate stones, which are extremely painful and difficult for the kidneys to manage. Spinach contains around 656 milligrams of oxalates per cup, and almonds have about 122 milligrams per ounce. When consumed together, the total oxalate load spikes far beyond what the kidneys can comfortably filter, especially for anyone with even mildly reduced kidney function. Do not forget that many people eat these combinations daily without realizing how concentrated the oxalates become. Have you ever blended a green smoothie with a big handful of raw spinach and a splash of almond milk? Or tossed a salad with baby spinach and a few almonds on top for crunch? Let us know in the comments. While this may look like a smart meal, from a renal standpoint, it is a high-risk combination. In my years working with renal patients, I have seen more than a few people end up in the emergency room with kidney stones who believed they were eating right. It is a frustrating and preventable problem, and it usually starts with not knowing how certain food compounds interact inside the body. For people already dealing with early signs of chronic kidney disease, or those who have a family history of stones or renal issues, oxalate control becomes essential. According to the Mayo Clinic, people who are prone to kidney stones should keep their daily oxalate intake under 100 milligrams. That limit is easily surpassed with just one serving of the spinach and almond pairing. The trouble is that oxalates are not always listed clearly on food labels, and many people do not know which foods are considered high oxalate in the first place. So what can you do instead? One smart option is to replace raw spinach with steamed kale. Cooking kale not only lowers the oxalate content, but it also retains fiber and nutrients that support kidney health without overwhelming the filtration system. Another option is to swap almonds for pumpkin seeds. Pumpkin seeds are much lower in oxalates and are also rich in magnesium, a mineral that helps prevent the formation of stones in the first place. Magnesium binds with oxalate in the gut before it ever reaches the kidneys, making it an ideal nutrient for anyone trying to protect their renal health. Have you ever mixed spinach and almonds together in a smoothie or a salad, thinking it was a healthy choice? Did you know that spinach has more oxalates than almost any other vegetable? Drop a comment below. If that surprised you, you are not alone. A lot of people are in the same situation. They do not know that their healthy eating habits may be backfiring. So keep watching closely because we are just getting started. Now let us move on to a combination that feels like a creamy and sweet brunch favorite, but comes with another serious kidney risk. This next pairing, bananas and avocados, is loaded with potassium, and too much of it can overwhelm your kidneys before you even notice something is wrong. Before we go any further, I would really like to hear from you. Where are you watching from, and what health goal matters most to you right now? If protecting your kidneys and staying stronger with age are priorities for you, make sure to subscribe and turn on notifications so you never miss strategies that actually help. If you find this content helpful, type 1 in the comments. If not, type 0, so I know what to adjust. Now let us talk about bananas and avocados, a combination that many people enjoy for its creamy texture and natural sweetness, but one that can silently push your kidneys toward danger without warning. Both of these foods are rich in potassium. One medium banana contains about 422 milligrams of potassium, and a whole avocado has close to 975 milligrams. When you eat them together, the total potassium load can exceed what your kidneys can manage, especially if they are already under strain. Most people think of potassium as a good thing, and in many ways it is, because it helps with muscle function and blood pressure control. But when potassium builds up in the blood, especially in people with even moderate kidney damage, it can lead to a condition called hyperkalemia. Do not overlook the danger here. Hyperkalemia is not just a small imbalance. It can cause symptoms like muscle weakness, numbness, and even changes in heart rhythm. In serious cases, it can trigger cardiac arrest. I have worked with patients in stage 3 chronic kidney disease who felt perfectly fine until they experienced a sudden spike in potassium from a few meals that seemed harmless. Many of them had no idea that their favorite combination of avocado toast and a banana smoothie was pushing their kidneys too far. It happens more than people think. Do you often eat these foods together? Has anyone ever mentioned how much potassium that adds up to in a single meal? Share in the comments. One of the biggest misconceptions I see is the belief that if something is plant-based and natural, it must be safe. But for kidneys, the source of the potassium does not matter nearly as much as the total amount you are consuming. If your kidneys are not filtering efficiently, then even the most natural food can become harmful. It is important to know which foods to combine and which ones to separate, especially if you are trying to reduce your risk of kidney problems over time. If you are looking for better options, consider switching to pineapple instead of banana. Pineapple is low in potassium and contains bromelain, which may help reduce inflammation. For something creamy and satisfying like avocado, try cucumber slices with a bit of hummus or olive oil. Cucumbers are hydrating, low in potassium, and very gentle on your kidneys. So let me ask you this. Has your doctor ever talked to you about potassium stacking? Have you ever felt symptoms like fatigue or irregular heartbeat after eating a high-potassium meal? Comment below. You might be surprised how often these signs go unnoticed. Next, we are moving to a breakfast pairing that is incredibly popular but shockingly acidic. The combination of dairy and processed meats, like cheese and bacon, loads your system with phosphates and sodium, and it is much more dangerous than it appears. Cheese and bacon may sound like a satisfying and comforting breakfast, but this common pairing can be a serious hidden threat to your kidneys, especially if you already have reduced kidney function or are trying to prevent future damage. Both cheese and bacon are packed with phosphorus, and not just the naturally occurring kind. Processed cheese and cured meats like bacon often contain added phosphate compounds, which are used to preserve texture and extend shelf life. These added phosphates are highly absorbable by the body, and that is what makes them so harmful. When phosphorus enters the body in excessive amounts, especially in its additive form, the kidneys have to work hard to get rid of it. If your kidneys are already compromised or just aging, they will not filter it efficiently. This leads to phosphorus building up in the bloodstream, which can trigger a process called vascular calcification. That is when calcium and phosphorus deposit in the blood vessels, making them stiff and less flexible. This condition increases the risk of heart disease and high blood pressure, and it is linked to more rapid kidney function decline. Do not forget, your kidneys and your cardiovascular system are deeply connected. When one starts to fail, the other follows. I often remind patients that phosphorus is not just about bones, although that is another concern. Excess phosphorus pulls calcium out of the bones, weakening them over time. This leads to higher risk of fractures and bone pain. Many people, especially older adults, eat bacon and cheese in the form of breakfast sandwiches, omelets, or casseroles, thinking they are just enjoying a hearty start to their day. But they may not realize how much phosphate is sneaking into their meals. Have you ever checked the ingredient list on your packaged cheese or bacon? You might be surprised to find terms like sodium phosphate or calcium phosphate. Those are the red flags. There is also research backing this concern. A study published in Nephrology Dialysis Transplantation in 2019 found that adults with higher phosphate intake had a 50% increased risk of kidney disease progression. This is not a small link. It is a significant one, and it confirms what we see clinically. I have worked with patients who had no clue how much damage was being caused just by the everyday breakfast choices they had been eating for years. And once phosphorus builds up, it becomes harder to lower without medical intervention. If you enjoy these flavors but want to protect your kidneys, there are smarter swaps you can make. Instead of processed bacon, try boiled eggs or even unsalted turkey slices. They offer protein without the phosphorus overload. If cheese is a must, choose ricotta or cream cheese in small amounts, which are lower in phosphorus compared to aged or processed varieties. You can also use a small serving of avocado for creaminess and satisfaction, but only if potassium is not a concern for you. Let me ask you directly, how often do you eat bacon or sausage with cheese in the morning? And have you ever noticed the word phosphate on any food label? If you have seen it, what did you think it meant? Comment below. Most people never realize it is something to look out for. Stick with me through each part, because the last two food combinations are surprisingly powerful, and I bet you have not heard of at least one of them. Next, we are going into a food pairing that often appears healthy at first glance, but can actually create serious stress on your kidneys. The combination of tomatoes and high-protein meals might surprise you with how much acidity and metabolic load it brings to your system. Tomatoes and high-protein meals may sound like a balanced and healthy choice, especially if you are trying to eat clean or support muscle health, but this combination can quietly burden your kidneys in several ways. Tomatoes are naturally acidic and contain a significant amount of oxalates, which are compounds that can bind with calcium and contribute to kidney stone formation. When you add a heavy protein source to that plate, such as steak, chicken breast, or a protein shake, you are also adding a considerable nitrogen load to your system. Your kidneys must work harder to remove that nitrogen waste, and this is where the real trouble begins. Have you ever felt bloated or sluggish after eating a tomato-rich meal with grilled meat or a protein supplement? That is not just digestion acting up. That discomfort often reflects a deeper issue related to how your body is trying to break down excess acid and protein. When acidic foods like tomatoes are paired with dense proteins, they do not just challenge the digestive system, they also raise the acid load in the blood. Your kidneys are responsible for managing that acid load, and if they are already under stress, they will not filter the extra waste efficiently. One of the lesser-known issues with this kind of meal is that it can significantly increase urinary calcium. Higher urinary calcium does not just affect bones, but also contributes to kidney stone risk. This kind of dietary stress does not take years to show up. In people with early signs of kidney dysfunction, it can speed up damage within months. Diets that are high in acid-producing foods, like tomatoes combined with animal protein, have also been linked to a higher rate of albuminuria, which is the presence of protein in the urine. This is one of the earliest clinical signs of kidney damage, and it should never be ignored. I have seen patients who thought they were eating responsibly by having grilled chicken with tomato sauce or a lean steak with a tomato-based salad. They were not adding salt, sugar, or processed foods, but they were still struggling with worsening kidney markers. This is because acid balance in the body is more complicated than just avoiding soda or junk food. Natural foods can still contribute to an acidic environment, depending on how they are paired. If you are aiming to support your kidneys, there are better ways to structure your meals. Instead of raw or cooked tomatoes, try using zucchini or yellow squash. These vegetables are much lower in oxalates and acid-forming compounds. And if you are eating high-quality protein, always try to pair it with a source of fiber, such as quinoa or cooked oats. Fiber not only helps reduce the acid load, but also slows digestion and supports better blood sugar balance, which is another important aspect of kidney health. Do you often prepare meals that include tomato-heavy sauces with chicken or beef? Have you ever felt digestive discomfort after those kinds of meals, but could not figure out why? And has your doctor ever mentioned the acid load of your diet or its impact on your kidney filtration rate? Now, let us talk about a pairing that almost everyone has had at some point, often without thinking twice. The combination of cola and fast food meals may feel like a regular part of life, but it is one of the most harmful duos when it comes to kidney function. Cola and fast food might seem like a convenient treat, but this combination can quietly become a nightmare for your kidneys over time. Cola contains phosphoric acid, which is a known kidney irritant. It also has caffeine and a heavy dose of added sugar, both of which can interfere with kidney function and increase calcium loss through urine. The fast food that often comes with it adds an even greater burden by stacking on saturated fat, excess sodium, artificial preservatives, and phosphate additives that are not always listed clearly on the label. Have you ever paid attention to the ingredient list on soda or the nutrition information on fast food meals? Most people do not, but that habit can come at a cost. One large cola can have over 40 grams of sugar and phosphoric acid listed among the top ingredients. This type of acid has been directly linked to increased risk of kidney stones and reduced glomerular filtration rate, which is a key measure of how well your kidneys are working. On top of that, fast food meals are typically loaded with sodium. One fast food burger and fries can easily exceed 1,000 milligrams of sodium, which is half or more of your recommended daily intake. That much salt pulls water into your bloodstream, raises blood pressure, and makes your kidneys work harder to get rid of the extra fluid. Over time, this pressure wears down kidney filters and raises the risk of chronic kidney disease, especially if high-sodium meals are part of your weekly routine. Do not assume that because you are young or feel healthy, your kidneys are not being affected. Many kidney problems do not show clear symptoms until significant damage has already occurred. In long-term studies, people who drank regular soda frequently were found to have lower glomerular filtration rates and higher incidence of kidney stones. These findings were especially clear in people who combined high-sugar beverages with sodium-heavy diets. Think back to your last drive-through meal. Did it include a soda? How often does that type of meal show up in your week? Small choices repeated often make a big difference. Instead of cola, try water with lemon or herbal iced teas without sweeteners. Swap the fast food for something like a grilled chicken wrap made at home with olive oil and fresh vegetables. That way, you reduce acidity, lower your sodium load, and give your kidneys less work to do. Now let us talk about a pairing that is often seen as healthy, but might be quietly contributing to stone formation. The combination of dairy with spinach could be feeding your body a high dose of calcium and oxalates at the same time. Combining dairy and spinach might sound like a nutritious choice, but it can quietly contribute to one of the most common and painful kidney issues. The concern here comes down to calcium from dairy and oxalates from spinach, joining forces to form calcium oxalate crystals. These crystals are a primary component of kidney stones, and repeated exposure to them increases the risk of stone formation over time. Do not assume this only matters if you have had kidney stones before. Even without a past history, if this combination shows up regularly in your meals, the impact can add up silently. Oxalates are natural compounds found in spinach, especially in raw form, and they bind tightly with calcium in the gut. While that may seem harmless, when these bound compounds are absorbed into the bloodstream, they can end up depositing as crystals in the kidneys. Over time, these deposits can grow larger and become stones that block urine flow and cause pain or even infection. Have you ever had a spinach lasagna, a cheese omelet with spinach, or a green smoothie made with yogurt and raw spinach? These are common meals, especially in health-focused diets, but when consumed frequently, they can load your system with the building blocks for kidney stones. Cooking spinach can reduce its oxalate content significantly, sometimes by over 30 to 50%, depending on the method used. That is a simple change that can greatly lower your risk. I often tell clients who struggle with kidney stone history or early signs of reduced kidney function to look closely at their vegetable and dairy pairings. Do not just trust that something is healthy because it contains greens or yogurt. It is the interaction between nutrients that matters most, especially when it involves minerals like calcium and compounds like oxalates. Would you be surprised to know that even people with strong family histories of kidney stones may not realize this connection? That is why being intentional about combinations is so important. Try switching raw spinach for lower oxalate greens like romaine lettuce, kale, or arugula if you are adding dairy. These greens support the kidneys without carrying the same risk of forming stones. So, let me ask you this. Do you often mix raw spinach with cheese or yogurt in your meals? Have you ever checked how much oxalate you're getting from your vegetables? These small dietary patterns can have big consequences if your kidneys are already under strain. Next, let us talk about a pairing that affects your kidneys with a double impact. When red meat is combined with alcohol, it pushes your kidneys into overdrive and can contribute to long-term damage. Combining red meat with alcohol might be a common part of celebrations or weekend meals, but it carries a hidden cost for your kidneys that most people never think about. Red meat is one of the most concentrated dietary sources of purines, which break down into uric acid in the body. When consumed often or in large amounts, especially without proper hydration or dietary balance, red meat significantly raises your uric acid levels, which can lead to both kidney stone formation and painful gout attacks. Uric acid stones are one of the most difficult types to manage because they often go unnoticed until symptoms appear suddenly and severely. Alcohol adds another layer of pressure to your kidneys. It interferes with the production of antidiuretic hormone, which means your body starts losing more fluids through urine even while you are drinking. That causes dehydration, and dehydration is one of the fastest ways to reduce kidney filtration capacity. Without enough water in the system, waste builds up more quickly, and your kidneys are forced to work harder to compensate. Now, when both red meat and alcohol are consumed together, especially in the same meal or within a short period of time, the result is what you could call a biochemical overload. The combination leads to higher acid production in the body, reduced urine output, and a rise in nitrogen waste and uric acid. These factors together are known to increase the risk of acute kidney injury, particularly in individuals with pre-existing kidney sensitivity or those who already have high blood pressure or diabetes. I have seen people with no previous kidney problems end up in the emergency room after what they thought was just a rich meal and a few drinks. The pattern repeats: a steak dinner, a couple of alcoholic beverages, followed by joint pain or abdominal discomfort within a day or two. What is even more concerning is how these small episodes can build up over time and contribute to long-term kidney function decline. So let me ask you this. Do you enjoy steak dinners with a glass of wine or a cold beer? How often do you choose that combination without thinking about hydration or moderation. Have you ever experienced a gout flare or kidney pain after a meal like that? If this sounds familiar, there are better ways to protect your kidneys without giving up flavor or enjoyment. You could try grilled fish instead of red meat a few times each week. Fish is lower in purines, rich in omega-3 fatty acids, and easier for your kidneys to process. And if you choose to drink alcohol, do not exceed one standard drink in a sitting and always pair it with extra water. That simple step helps maintain blood volume and reduces the dehydration effect caused by alcohol. Now, before we wrap this up, let us move to one powerful bonus tip that can help protect your kidneys, no matter what type of meals you prefer. This is a habit I often recommend, and it can make a noticeable difference over time. Ready to hear it? Let us talk about something that is often overlooked but can make a meaningful difference for your kidneys, no matter what kind of diet you follow. It is called the 2-hour rule for kidney relief, and it is about giving your kidneys a real break between eating sessions. Do not underestimate how powerful this simple habit can be. Most people are constantly snacking or sipping on calorie-containing drinks all day long without realizing how that keeps the kidneys working non-stop. Each time you eat, especially if the food is high in protein, potassium, phosphorus, or added sugars, your kidneys go to work filtering and managing those compounds. By constantly putting food into the system every 1 or 2 hours, you remove the natural break that kidneys need to rest, reset, and clear out waste more efficiently. That leads to a state of low-level stress on your kidneys all day long, which over time contributes to inflammation, impaired filtration, and even contributes to the development of insulin resistance. Studies have shown that giving longer breaks between meals can support better metabolic balance and reduce pressure on organs involved in waste processing, especially the kidneys. So what is a better strategy? Try eating just 3 full meals per day with 4 to 5 hour gaps between them. That simple shift lets your kidneys catch up and process everything more thoroughly. In between those meals, focus on drinking water rather than juices or snacks. Do not wait until you are thirsty, because thirst is already a sign that your body is behind on hydration. Another key part of this rule is avoiding bedtime snacks, especially those high in salt, protein, or phosphorus like cheese, deli meats, or protein bars. Nighttime eating not only disrupts sleep quality, but also prevents kidneys from benefiting from their natural nighttime recovery phase. Do you give your kidneys a break between meals, or do you find yourself grazing all day? Have you tried following structured mealtimes and noticed a difference in how your body feels? If you want me to send you a sample kidney-safe eating schedule that follows this 2-hour relief strategy, just comment "Send schedule" below, and I will get that to you. If this video has helped you think differently about food combinations and kidney health, do not forget to like it, subscribe for more insights like this, and drop a comment to let me know what you found most surprising. In the next video, I'm going to walk you through something that most people never connect to kidney health, but it plays a huge role. You will not want to miss it.